Okay, we are back. Senate Health and Welfare. And Jen, do we have a new draft on S74?
You
Or
do. We have a
amendment?
strike all amendment. Yep. Want me to
Okay.
put it up?
Yes, please.
Okay. I'm at the end of it. Okay, so this is an amendment to S74, draft 1.1. It is a strike all amendment. And I did put in a couple of definitions. I started by referring to them, but they're a little, the references are to insurance statutes and it seems a little muddy that way. So I put the definitions in instead and just use the language that's the same. So definitions of healthcare services, meaning services for the diagnosis, prevention, treatment, cure, or relief of a health condition, illness, injury, or disease. So a definition we use in a few other places in the statutes. And telemedicine, which is taken from the insurance statute that we also then refer to in the healthcare providers delivering services using telemedicine statute. That is the delivery of healthcare services, including dental services. Maybe we don't need that piece specifically in here, but I'll let you decide. It's the same definition we have in the insurance statute, such as diagnosis, consultation, or treatment through the use of live interactive audio and video over a secure connection that complies with the requirements of HIPAA. I think I'll take out dental services. Not really relevant to this. It's not. Doesn't make it unincluded. It just doesn't need to be called out. So then we get into section 2, which had been section 1 in the original bill, and that is the requirements for prescription and documentation, and continues to say that a physician would not be subject to civil or criminal liability or professional disciplinary action if they prescribe to a patient with a terminal condition medication to be self-administered. The purpose of hastening the patient's death, and the physician affirms by documenting in the patient's medical record that all of the following occurred. So the first is that the patient made an oral request to the physician in the physician's physical presence or by telemedicine if the physician determines the use of telemedicine to be clinically appropriate for medication to be self-administered for the purpose of hastening the patient's death. And similarly, in the next one, no fewer than, actually I still should keep this, not fewer than, I'll make that change, not fewer than 15 days after the first oral request. Oops. Try to make that change right now. Not fewer than 15 days after the first oral request, the patient made a second oral request to the physician in the physician's physical presence, or again, or by telemedicine, if the physician determines the use of telemedicine to be clinically appropriate for medication to be self-administered for the purpose of hastening the patient's death. And we drop down to number 5. The physician determined that the patient was suffering a terminal condition based on the physician's, and others would say, review of the patient's medical records and a physician's physical examination of the patient. And then we have was capable, was making an informed decision. And then this is just changing that gendered language, had made a voluntary request for medication to hasten the patient's own death and was a Vermont resident. And then in number 6, the physician informed the patient in person or by telemedicine. And then we do have this both verbally and in writing, but I think you could still have something in writing, even if it was by telemedicine, either to be sent to the patient or put up on the screen. But I wanted to flag that as a little different. But the physician informed the patient in person or by telemedicine, both verbally and in writing, of all of the following. And then we don't make changes to that list. Then we have the physician wrote the prescription, and then we took out not fewer than 48 hours. So just the physician wrote the prescription after the last to occur of the following events. And I took out the gendered language here. So we have the patient's written request for medication to hasten the patient's own death, the patient's second oral request, we've changed the or to and, the physician's offering the patient an opportunity to rescind the request. And this one is another change for gendered language. So the physician either dispensed the medication directly, provided at the time the physician dispensed the medication, the physician was licensed to dispense medication in Vermont, etc. And then taking out a few more instances of gendered language here, the physician recorded and filed the following in the patient's medical record, And I just, again, replaced hasten his or her death with hasten the patient's own death. So that's an A, B, and E. And then that is it for that section. And then section 3, which had been section 2 in the original bill, is the limitations on actions. And this would now say no physician, nurse, pharmacist, or other person licensed, certified, or otherwise authorized by law to deliver healthcare services. That's why I included that definition in the first section. In this state shall be subject to civil or criminal liability or professional disciplinary action for acting in good faith compliance with the provisions of this chapter. And that's, and then we need our effective date section. It's running out of time, but I will put that.
I just add a comment here that the letter from Steve Hochberg is now up on our webpage. And I think you'll find it helpful regarding the pharmacist position.
Now we have an effective date.
That's it. Okay. Committee, questions of Jen?
Looks
Okay,
good. Thank you.
good. Nice work, Jen. You've
Thank you.
moved through a lot of difficult areas. We appreciate it. So,
So I will put this in for editing. So we
Okay.
can make sure I haven't missed anything.
Senator Hardy, you wanted to share a communication from Dr. Barnard?
Yeah, I just wanted to tell Senator Cummings that I reached out to Dr. Diana Barnard regarding your question about the medication. And she's going to send something that I can share with the committee clarifying the issue with the medication. And I don't want to paraphrase what she said because I'll get it wrong, but I'll send it to you all when she sends it to me this afternoon. So you'll have it before we vote on the bill.
Okay.
Perfect. Thank you. Thanks for doing that. So committee, my thinking is then that we have this proposal of amendment before us. Jen will put it through editing. And tomorrow, we do have a full morning, but Jen, I don't know what your schedule is. And whether you're going to be with us for the beginning with the task force or not. And
I
then,
am going to be with you for the task force, and it looks like there's a little window between when the task force is supposed to end and when I'm supposed to be in-house healthcare. That might work perfectly.
okay, so maybe what we'll do is, because it'll be Aaron will be putting the Zoom up. And Aaron, I think we can go off YouTube